Young people confront many special challenges as they grow up. Some things can get out of control. If stressful events such as divorce or moving home are added, it can seem impossible to act sensibly and effectively. When trying to compensate for this loss of control, an eating disorder can develop. But what exactly is that? Eating disorders are an expression of deep psychological problems. Specialists have identified anorexia, bulimia, and binge-eating disorder. Most of the time, they appear in combination. Each one is a serious disease that requires treatment. The most common characteristic of anorexia is severe weight loss or persistent weight deficiency. If you're anorexic, you're terrified of gaining weight and thus reduce your food intake and continue losing weight. Although noticeably thin, you consider yourself out of shape and fat. The key characteristic of bulimia is binge eating, which occurs repeatedly. If someone suffers from bulimia, they try to prevent weight gain, for fear of getting fat, by vomiting after a binge. Other activities may include excessive exercise, intermittent starvation or fasting, as well as the consumption of certain medications. And suffering from a binge eating disorder means repeated binges. But this time, food is retained, which leads to weight gain. Nobody is to blame for an eating disorder, neither the affected individual nor their environment. Eating disorders are not fat diets or a temporary puberty crisis. Furthermore, they can be treated. The first points of contact are pediatric and youth doctor surgeries, or family doctors and particularly local counseling centers. Treatment can be outpatient, inpatient, or at a day clinic. After therapy is completed, aftercare is sensible, in a residential group for example, or via self-help therapy or outpatient care. The earlier help is sought, the better the chances of a cure. The Eating Disorders Helpline, provided by the Federal Center for Health Education, offers a preliminary consultation with specialists and provides contact points near your home. Addresses for counseling centers can be found at www.bzga-essstörungen.de.